welcome to Early Care Connection. I'm Izzy Greenberg. Today we are joined by our usual panel of experts, Meryl Gay from the Connecticut Early Childhood Alliance and Ava Bermudez-Zimmerman from Child Care for CT. We also have special guests here to present on the CT Rapid Survey. So just a few quick reminders to everyone. First, thank you to Laura for providing interpretation for us today, and just a reminder to all of our guests to speak slowly enough for her to be able to catch up and get the information needed to everyone. We are having a little bit of an issue with the Spanish interpretation file, so I will share both out, but if you see that it is being translated like minute by minute, slide by slide, it's because we're working behind the scenes to get that translated in the course of the presentation. Not ideal, but there were some technical glitches today. And as you all know, we're a tiny team, tiny but mighty, always doing our best. And that includes our presenters, who are always also tiny but mighty teams doing their best. So we're going to get that done today, but you'll see it's kind of happening in real time, unfortunately. The chat is a great space for you all to talk to each other or to share any technical difficulties there might be happening. And the Q&A is the place for questions for the panelists. So all of that said, I am going to introduce Allison Logan. She is the co-founder of CT359, and she is going to be leading this presentation on the Connecticut Rapid Survey. So Allison, I'll turn it over to you.
Good morning, everybody. I'm Allison Logan, a co-founder of CT359. CT359 is a network, I think upwards of 90 people now, of individuals, organizations focused on the health, well-being, and early success of Connecticut's younger children. I am going to turn it over right away to my friends and partners at Courtney Parkerson at the Connecticut Project and Cynthia Wilner at the CT Data Collaborative to talk to you today about our recent, over the last couple of years, work with the Connecticut Rapid EC Survey Project. So Courtney and Cynthia, I'm going to turn it over to you right away.
Good morning, everyone. I'm Courtney Parkerson. I'm a director with the Connecticut Project. The Connecticut Project is an organization that brings together people, ideas, and resources to create opportunity. And I'm honored today to be presenting along with Cindy Wilner from the Connecticut Data Collaborative on findings from the Rapid Survey Project. Before I turn it over to Cindy to talk about some of the findings from our surveys, I wanted to give you a little bit of background about what the Rapid Survey Project is. So Rapid is a project of the Stanford Center on Early Childhood at Stanford University. It started as a national survey in 2020, and now it partners with states and communities on local surveys as well. The goal is to provide actionable, ongoing, and timely data from parents of young children to promote data and parent-informed policies and programs. Next slide, please. We're incredibly fortunate to have a wonderful advisory committee supporting us in this work. So in addition to the Connecticut Data Collaborative and CT359, we're also working with the Connecticut Network for Children and Youth on this project. Next slide. The work would not be possible without our community implementation partners. And so we have been partnering with these 17 organizations over the past 18 months. And we've relied on them and the trusted relationships that they have with parents to recruit parents to complete the surveys. These organizations represent all 8 counties in Connecticut, and as you can tell, are very geographically diverse and diverse in terms of the types of work that they do. They've done an incredible job exceeding our survey completion targets in every single cycle of the survey, and we're so grateful for all of the work that they've been doing on this project. Next slide. So today you will hear about findings from our second and third surveys, which focused on access to developmental screenings and referral to services, as well as financial well-being. We have also surveyed parents on topics like early relational health and early literacy. We did a deeper dive into housing and healthcare access, and we currently have a survey that's out in the field right now on childcare enrollment and navigation. Next slide. So now I'm going to turn it over to Cindy Wilner from the Connecticut Data Collaborative to walk through findings from our second and third survey. Cindy, over to you.
Thank you, Courtney. I'm Cindy Wilner. I'm the Director of Research at CT Data Collaborative, and it's been my great honor to be involved in this project, both in helping to design the surveys and analyze the results and share our findings out with the community and the public. And today I'll be talking about findings from our survey on developmental screening and access to services, and our survey on financial well-being and material hardship. We'll first talk a little bit about who responded to these surveys. I'll go into results from the survey on developmental screening, and then I'd like to just pause for discussion for a little bit because these are very different topics, and I don't want your thoughts about the first one to get lost as I start talking about another topic. Then I'll delve into findings on financial well-being and material hardship, and we'll pause again for discussion. So please do feel free to put questions in the Q&A as I talk, and I will answer those at the pauses. So these surveys were implemented in the summer and fall of last year. All primary caregivers of children under 6 years old across the state were invited to participate. And as Courtney mentioned, families were recruited by 17 community-based organizations. Our partners used a variety of different methods to recruit parents to complete the survey, including flyers, email lists, in-person community events, text messages, and also including home visits with parents and via the Sparkler app. So as I talk about access to developmental screening and connections with services, it's really important to remember that this is not a representative survey of all families in Connecticut. These families are more likely to be connected with services and, for example, to be using Sparkler because of how they were brought into the survey through these community-based organizations. We received over 2,000 responses to our second survey on developmental screening and over 1,000 responses to our survey on financial well-being. Both surveys received responses from families across the state, and you can see responses to survey 2 on the left and to survey 3 on the right. However, it is important to note that certain cities and towns are somewhat overrepresented in our survey samples relative to the overall population of families with young children in Connecticut. And again, this is because of the reliance on community-based organizations to recruit families into the survey. And families in communities where those organizations are working are a little bit more likely to be in our survey sample. We got responses from a racially and ethnically diverse group of parents, about half of whom were white, 18 to 23% Latino, 16 to 19% Black or African American, and about 8% other races or ethnicities, including Asian. About 85% of respondents were born in the United States, and about 80% were dual parent families, meaning that there were 2 parents in the home. Survey respondents tended to have lower household incomes than families statewide. In both surveys, respondents' median household income was about $70,000. In comparison, the statewide median household income for a family of 3 is $123,000. And it is important to note when talking about differences by race and ethnicity that median household income varied by race and ethnicity, with white respondents having a median household income of about $80,000, Latino respondents having a median household income of just $45,000. And so these questions of differences by race and income are intertwined. Now I'll dive into some of the findings on access to developmental screening in connection with services. We asked parents if any of their children had received a developmental screening. For under age 1, we asked about in the past 3 months, because we know children develop very rapidly at that age. And for children ages 1 to 5, we asked if they've been screened in the past year. And about 3/4 of parents said that yes, my child has been screened in the past 3 months or in the past year. But that means about 1/4 of parents said that no, their child had not received a screening that they could remember. For children who were screened, we asked who conducted the screening. And respondents were able to select multiple responses. So almost 3/4 of respondents said that, and here we're talking about infants under 1 year old, and almost 3/4 of respondents said that their infant had been screened by a pediatrician in the last 3 months. Meaning again that over 1/4 said that their pediatrician, they couldn't remember their pediatrician having conducted a screening of their infant in the past 3 months. About 1/4 said that a teacher or childcare provider had conducted a screening, and 21% said they'd conducted a screening at home. It is likely that many of these were conducted using the Ages and Stages questionnaire via Sparkler, which I'll talk about in a moment. For children ages 1 to 5 years old, we saw a similar pattern of results, although there was a higher prevalence, a higher likelihood of children being screened by a teacher or childcare provider, with about 34% saying they'd been screened by a teacher or childcare provider in the past year. So as I mentioned, a number of parents participating in this survey do use the Sparkler app for parents, which, as you may be aware, provides screenings that parents can complete on their own via the Ages and Stages questionnaire. So about 57% of parents said they'd at least heard of the Sparkler app, and 23% of those who responded to our survey said that they currently use it. And of those who said that they use or have ever used the app, the vast majority, 90%, had completed at least one Ages and Stages questionnaire through the app. So this is a really great way that parents are engaging with conducting developmental screenings on their own children. And about 41%, so a little under half, had completed every Ages and Stages questionnaire that they received through the app. We then asked parents whether they or a professional had ever had any concerns that their children were not meeting expected developmental milestones. And we asked about their receipt of services to support their children's development. About 3/4 of respondents reported that neither they nor a professional had been concerned that their children were not meeting the expected developmental milestones. They had no concerns and no professional had expressed concerns. About 10% reported that they had had concerns that were not first raised by a professional, and 11% reported that a professional had raised a concern. And 5% reported that both they and a professional had concerns. We found that the lowest income respondents, those with household incomes below 30% of the state median income, were most likely to report that a professional had expressed concern that their child was not meeting expected developmental milestones. And they were least likely to report there being no concerns about their children's development. Overall, about 1/3 of these parents either had a professional express concern or had their own concerns about their child's development. The good news is that in our survey sample, at least, nearly all parents were sharing their concerns with a professional. Of those parents who had a personal concern about their children's development, 92% reported that they had shared that concern with a professional. And we found no significant variation in this rate by parents' race and ethnicity or their income level. We then asked parents what happened when concerns about your children's development were raised, either from a professional or by yourself. 40% of parents reported that they were referred for an evaluation for early intervention or special education services. 34% were encouraged to use the Sparkler app to track their child's development, and 39% were referred to other developmental monitoring resources, such as information about developmental milestones. 16% were assured that their child was developing normally, and 13% were told to wait and see. When we look separately by whether the concern was raised by the parent only or by a professional, we do see that concerns raised by a professional were significantly more likely to result in a referral for an evaluation for eligibility for early intervention, special education, or clinical services. Less than half of concerns raised only by the parent resulted in a referral for evaluation, while 62% of professional raised concerns resulted in a referral for evaluation. It does seem that most parents who were not referred for an evaluation were provided with developmental monitoring resources like the Sparkler app. And only 9% of parents said that the concerns that they raised with the professional were not taken seriously. Among parents who said that they were connected with services, we asked how satisfied they were with the support that they received in getting connected to services. And the majority said that they were satisfied. 61% said yes, 33% said they were at least somewhat satisfied, and only 7% said that no, they were not satisfied with the support they received getting connected to services. In our survey sample, 74% of parents reported enrolling a child in at least one type of support service. 48% of parents had a child enrolled in home visiting services, 39% in birth to 3 or preschool special education, 29% in private therapy or counseling, and 10% in another kind of service. And again, it is important to remember that these are parents who are connected with community-based organizations, many of which provide some of these services. So again, this is not a representative sample, and I wouldn't expect these rates to be the same if we asked random families across the state. And we asked, how hard was it to access services for your child? And about 60% of respondents said that it was easy or very easy to access services for their child. Only about 10% said that it was difficult or very difficult. However, this did vary by parents' race and ethnicity and their income. White parents were most likely to report that it was easy or very easy to access support services for their children, while as parents identifying as Black or another race or ethnicity, including Asian or Native American, were less likely to say that this process was easy for them. And we saw a clear relationship between household income and how easy parents found it to get connected with support services. With the lowest income households, only half or slightly less than half saying that it was easy to get connected with support services for their children. And the higher income households in the sample, more than or 3/4 of them saying that it was easy to get connected with services. And we asked, did the services that your child received meet their needs? And 71% said that yes, they did. About 23% said somewhat, and only 6% said that no, they did not meet their needs. So overall, a pretty high rate of satisfaction with the services. This also, however, differed by parents' race and ethnicity. Again, with white parents being the most likely to feel that the services met their children's needs, and parents identifying as Black or another race or ethnicity being less likely to find that the services met their children's needs. And again, we see the same pattern by income, with lower income families being less likely to find that services met their children's needs. So here I'd like to pause for a moment just to see if anyone has entered any questions in the Q&A, or give you a chance to enter a question or a comment or thought that you would like to share with the group.
No questions from the audience yet, but folks, you're welcome to place your questions into the Q&A for our guests. And also, since I'm on, just to let everyone know that the Spanish slides are all translated. It's available now. I'll repost the link. I think you could probably continue. Yeah.
Okay, great. Well, if anything pops up for you, you can always ask at the end as well. So now we'll review some results focused on families' experiences of financial security, banking, and savings. So we asked respondents, which of the following best describes your family's financial situation at this time? And we found that only 33% of participants describe themselves as financially secure. An additional 42% said they were somewhat financially secure, but a quarter said they were not at all financially secure at this time. When looking at low income respondents, those with household incomes below 50% of the state median income, the number who said they were not at all financially secure jumped to 39%. And we asked whether they have a bank account, meaning a checking or savings account at a bank or credit union, online bank, or other type of bank. Overall, 90% of respondents said that they did have a bank account. But among low-income respondents, this percentage was only 82%. And 18%, so nearly 1 in 5 of these lower income respondents did not have a bank account. This is notably high, especially when compared to a national benchmark from a 2023 FDIC survey, which found that only 4.2% of Americans overall are unbanked, meaning that they do not have a bank account. We asked respondents if their household had any money set aside that they would consider savings. And overall, 60% reported that they did, meaning that 4 in 10 did not. And as you would expect, the percent of households who said they have money set aside for savings varied dramatically by income, with 84% of our higher income respondents saying that they had savings, and only 31% of those with household incomes below 30% of the state median income saying that they had any money set aside for savings. And we asked, could you afford a $1,000 emergency expense, an unexpected or emergency expense, without going into debt, such as borrowing from family or friends or putting it on a credit card? Overall, less than half of survey respondents said that yes, they could do this. And the situation is especially stark for low-income households. Only 29% of these households reported that they could handle an unexpected $1,000 emergency expense without going into debt. For context, a recent national bank rate survey found that only 41% of households overall could cover a $1,000 emergency expense in cash. The ability to pay for an unexpected $1,000 emergency expense varies significantly by race and ethnicity. Less than 3 in 10 Latino respondents said that they could afford such an expense without going into debt. And slightly more than a third of Black respondents said that they could afford such an expense. And more than half of white respondents said that they could. Next, I'll talk about families' experiences with material hardship, the impact that financial security can have on the ability to afford basic day-to-day needs. respondents were asked, in the past month, how hard has it been for you to pay for the very basics like food, housing, medical care, and heating? A little over half, 55%, of all respondents described it as being at least somewhat hard to pay for these expenses. This percentage jumps to 73% among those who are low income, that is below 50% of the state median income. Another key indicator of financial stress that we asked about was food insecurity. Respondents were considered food insecure if they said that at least sometimes in the past year, they worried that their food would run out before they had money to buy more, or their food actually didn't last and they couldn't afford to buy more in time. By this measure, nearly half, 48% of all respondents were food insecure. Among low-income respondents, that number jumps to 70%, a clear signal of financial hardship. When asked whether any basic needs had been hard for their family to pay for in the past month, over a third of all respondents said that they'd had a hard time paying for utilities, and roughly a quarter of respondents said that they'd had a hard time paying for housing, childcare, food, wellness activities, or healthcare in the past month. Thus, it's clear that a substantial number of families are struggling to meet their basic needs, including paying for childcare and other necessities. In this next and final section, we'll review the impacts that financial insecurity is having on families' purchasing habits and mental health and well-being. 4 out of 5 respondents said that they were reducing their spending on at least one basic need due to their financial situation or rising costs. This includes 9 out of 10 low-income participants, but also 2/3 of participants with household incomes at 80% of the state median income or higher. So while low-income participants are reporting the highest rates of reducing their spending, all income categories reported a significant level of reduced spending on basic needs. About half of respondents said that they were reducing their spending on wellness activities, including recreational activities and mental health services. Over 2 in 5 respondents also reported reducing their spending on household items, including things like cleaning supplies, children's items, including things like books, school supplies, and toys, food, or utilities. Among respondents who said they were not financially secure or only somewhat financially secure, over half, 52%, said that their financial situation had negatively impacted their mental health and well-being, either somewhat or a lot. These respondents were also asked to what extent their financial situation negatively affected their children's mental health. 25% of respondents, or 1 in 4, reported that there was at least somewhat of a mental health impact on their children's mental health. This is lower than the proportion who feel there was an impact on their own mental health, but still a concerning result to confront. And this negative impact of the family's financial situation on children's mental health was especially pronounced for low-income respondents. Nearly a third of those households, below 50% of the state median income, reported a negative effect of their financial strain on their children's mental health. So those are the findings that I brought to share with you today. I definitely welcome discussion around these findings. Any questions, surprises? Oh, and I believe Allison, you might be offering a discussion as well.
Sure. Thank you, Cynthia. Thank you, Courtney. Courtney, I just wanted for you to follow up with folks about how CT Project and CT Data, how you're using this data, and what you're using it for in your work and for advocacy purposes across the state.
Yeah, so there's several different use cases for this data. We used data from the first survey, which I think we presented on this call previously, around access to childcare and affordability, a lot in this last legislative session. The findings about how difficult it is to access affordable childcare was really critical in our advocacy efforts. We're also using data from other surveys to inform program design and delivery. And so I know many of our community-based partners have been using more localized findings from the surveys to understand how they can better serve families, how they can better design programs to meet families' needs. This last survey, that the data that Cindy just shared on material hardship, we've been, I put a link in the chat to the recently published fact sheet. We've had some press inquiries around it. And so there was a recent article that came out last week that highlighted these findings. And so, we're using it to inform decision making at many different layers of the system for policymakers and for those that are engaged in direct services with families.
Thanks, Courtney. And there's also a question in the question box. Were you able to compare families' experience with access to services by type of service? For example, home visiting versus birth to 3. I think that goes to you, Cynthia.
Yeah, that's a really great question. We haven't actually looked at that. I'm not sure if the sample size would support looking within type of services, but I can see for some home visiting, we had a pretty large number of parents participating in that. So yeah, we can look at that. Thank you for the question.
Janice?
Thank you. This is stunning. Thank you, Cynthia, and also Courtney for taking this on to start with and then sharing this information. I'm curious. I have two kind of questions and I don't know how to deal with them. The first is I'm curious how the 200 plus listeners on this Grand Rounds see this information as reflective of the families that they serve. That's the first one. And the second one is how we might think about together in some kind of partnership, looking at these kinds of surveys, particularly with Medicaid families, because 1 out of 2 children are enrolled in Medicaid, and that is the funder for some of this stuff. I don't know what to do with that, but we have an interesting and evolving working partnership with the Medicaid program. So that might be worth some further explanation, not online necessarily, but as we think across the Early Care Alliance and then also CT359. Thanks, Allison.
So maybe folks in the chat can actually write how this data is reflective of their own experience and of their own community that they live and work in, and how it was either similar or not similar to what they're finding. So if we can want to put some of that in the chat. And then any other questions can go in the question and answer. And maybe it'd be helpful to talk about how the survey topics got chosen, and talk about how communities are choosing the topics, and how the communities that were involved in the survey are actually involved in the process of the survey. Courtney, if you want to talk a little bit about that.
Sorry, Allison, I got distracted by the chat. Can you repeat that question?
Sure. If you can talk a little bit about how the communities are involved in the creation of the survey, and then how what types of methods that you're communicating to the survey participants the information back.
Sure. So yeah, we have an open feedback loop with the community implementation partners that we're working with. And so when we receive the data, we have data briefings with our community-based partners to share what we've learned. And we also open it up for conversation for topics for future surveys in those meetings. And so really do rely on our partners to lift up topics that they're interested in learning about. then so partners get access to the findings after each of the survey cycles. They also have an opportunity to request more localized analyses. So a lot of the data that Cindy just shared was statewide. But as long as we have an adequate sample size, we can actually do analyses on more localized communities. And we've been sharing data and information back with our partners that way. Families who complete the survey receive newsletters every survey cycle with findings from the prior survey. So we're sharing back with families what we've heard from them and what other families are saying. So families are hearing directly about, what other families throughout the state are experiencing through the newsletters. We publish fact sheets like the one that Meryl just put in the chat. We also publish findings on the Connecticut Project blog and use the data that way to write stories. And the Connecticut Data Collaborative also has a tremendous rapid data hub that they're building. And so we have a data story published there from our first survey, as well as another analysis they did combining rapid data with data from the census. And we'll continue to publish data stories, data dashboards, and other analyses on the Connecticut Data website as well.
Thank you, Courtney. I'm going back to look in the question box.
Could I just ask?
Oh, go ahead.
I'm
Jen.
sorry. Could I just ask one question? This is to the panelists because there are just so many of us on. I am thinking a lot about what is going on in the lives of families today, with federal changes and things like that. And I'm curious if you as panelists, perhaps Courtney and Cynthia particularly, but not only, if you expect that if we were to conduct this survey a year from now, we would see very different outcomes. We're hearing stories about parental fear and not getting to places like their child care centers and their Head Start centers and their family and for family child checkups and maternal checkups at federally qualified health centers. What do you see? Do you see an impact? And should we maybe think about treating this as baseline and doing this again in a year or so?
Yeah, I think it's a great question. I mean, as you know, Janice, this survey was actually fielded almost a year ago at this point. So it was well before a lot of current federal policies were implemented. And so I do think it's worth considering this as a baseline.
Thank you.
And there's another question. I noticed that there were fewer respondents for survey 3 than survey 2. We heard in our community that some parents stopped responding when they got to the questions about their household income, despite our advocates telling them that their data is confidential. Any reply or respond to that?
I'm not sure if you want to jump in, Courtney, if you'd like me to.
Do you want to, jump in? Cindy?
Sure. So actually the raw number of responses we got to survey 3 was actually higher than survey 2, but being an online survey, we dealt also with a large influx of fraudulent responses. And so we had to, it can be hard to tell the difference between a real response and a fraudulent response. To ensure that we were working with quality data, we had to remove responses that looked like they could be coming from a bot and not a human, and that reduced the sample size.
And then this goes, oh, go ahead, Courtney.
No, I was
Sorry,
just going to say, I
that
think we actually can tell where families might drop off in terms of like responding to the survey. And I don't think we've seen like a noticeable drop off after the income question. So yeah, we've been really working with supporting our partners around explaining why we're asking certain questions. And, in terms of income, we're emphasizing the fact that we want to be able to report on how families of various incomes might be experiencing these issues. And so that's the reason why we're asking that question.
And then the next question goes to Janice's point. really disheartening to hear about how many families are reporting financial hardship and food insecurity. You mentioned that the surveys will be completed in early 2026. Will there be other opportunities to understand the impact of HR 1 on families, since many of the changes will go into effect 2026 and later?
Yeah, so our specific partnership with Rapid on these surveys included a series of 8. We're now at survey 6 out of 8. And so we will be putting together another survey at the end of this year in 2025, and then fielding our final survey in the first quarter of 2026. We don't have plans to field surveys beyond that point in time, at least with the Rapid project. But I think it's a good question, and I think there's a lot of opportunities to continue this type of survey work in the future.
So I will just say that for folks who saw the Alice report last week, this data is all consistent, that the financial strains are impacting more families. It's spreading out into the suburbs and into the more rural areas as well as in the cities. There are lots of uncertainties here.
And Rapid EC National put out a new report. If I could find it quickly, I'll put it in the chat, about the correlation between material hardship, family stress, and child development. So there's an amazing new Rapid EC report on that. So if we're really looking at using the data on material hardship to really figuring out family stress, and then really looking at, the impact of that on child development here in the state and, across the country. So I'm gonna, Janice, I don't know if you have another question to discuss. I'm gonna try to find that quickly to put it in the chat so everybody has that. Oh, you're on mute, Janice.
I should be on mute more often. We would probably all agree. There's a huge developmental literature on the impact of residential instability and young children's development. Well, all children's development, but that's where young children's brains and their relationships are growing fastest and should be strongest and most positive. I suspect that as we get into 2026 and then 2027, in addition to the specific social service and childcare issues that we are all focused on, we need to be looking at housing and residential data and shelter data, because I suspect we're going to see an increase in those places. It's especially relevant to Connecticut, where we're now struggling as a policy issue around, affordable housing and stuff. So just to put a pin in that one as a come around issue, it's no more important, but no less important than the other stuff we probably need to look at.
Okay, I'm putting it in the chat. There you go. So that's a really great article that really shows the connection between the stress and material hardship and child development. I hope that's the whole article. It might just be the fact sheet. Any other questions, comments? I don't see any more in the chat. Oh, here's another one. Oh, glad to hear your response. Maybe our advocates elevated the parents we heard that from, and it was fewer than they said, was a reply. I don't see any more questions. Any other questions from the panelists or conversations we need to have?
Alison, could I just express from the side of CT 359, where many of you are members, and we're grateful for that. This emerging partnership between the network and the Alliance, I think, has the potential to be really helpful for all of us, leveraging the various constituencies that we reach, and then we're going to need more of it. So Merle, thank you, and Izzy, thank you for allowing us to slip into a couple of these. This might be our third one that we have co-hosted with you over the last couple of months. I hope we can find more. So thank you from the network.
Thank you. We appreciate you being here. And, you know, these calls tend to, well, these calls are a partnership between a lot of different organizations. We get hundreds of early care providers here, which really are the heart of this network, or these calls, I should say. And so, of course, always grateful to all of the folks who show up every week to learn with us. So thank you all. I think we're all set on this. You guys feel like, was there anything else? Okay. Thank you so much, Courtney and Cynthia, Janice and Allison, for being here. This is really interesting data. We've shared both the English and the Spanish PowerPoint in the chat. There's a little bit more information on the survey and the data specifically. Of course, as always, this recording will be up in the next 24 hours, and the links to the chat file, which is where all of those links will be, is in the description of the video. So you can go to, it's the Early Care Connection YouTube. Easiest thing to do is to hit subscribe so that whenever we post a video, you get an email notification and you don't have to keep checking back. I know that everyone's just sitting there checking their YouTube all day to see if we posted a video. Well, we can relieve you of that suffering. Okay, so thank you all. We do have a couple more quick updates before we end today. So thanks to our guests, and Meryl, I'll turn it over to you.
Okay, if you didn't see it early or last week, I just stuck into the chat a link about the great news out of New Mexico, which is now the first state in the country to have universal free childcare for families. They took their equivalent of Care for Kids and augmented it with a lot of state dollars coming from a trust fund using oil and gas revenues that New Mexico has to expand their Care for Kids system to cover everybody with no income limit and to eliminate all parent fees. That is a great example to hold up and say, why can't we do that? Balancing out that good news is some concerning news out of Washington. The federal budget is up for renewal as of the end of this month. So there are 2 weeks for them to pass a budget. They haven't passed a budget on time in many, many years. So nobody really expects that they will accomplish that this year. Things are more complicated than usual. So what happens if there isn't a budget is one of two things. Either a continuing resolution that says we continue spending at our current levels and for some period of time so we have some more time to negotiate, or a government shutdown. And we haven't had a real government shutdown for a while now, but things seem like we may be headed in that direction. So where things stand in the negotiations around the early childhood part of the federal budget, the Senate Help Committee has passed bills that make some modest increases in things. The House has flat funded things. So there has to be a negotiation between them to decide, you know, whether or not the Child Care Development Block Grant will get additional funds, that sort of stuff. But the bigger issue is that the big, beautiful bill that was passed over the summer makes a bunch of big cuts to healthcare. The most immediate one is ending the subsidies through the advanced premium tax credit that help people buy health insurance through the exchange. And so it looks like the congressional Democrats are going to hold out for some change to that in order to vote for a continuing resolution. And so that could end up precipitating a government shutdown. That means that federal payments for everything kind of get put on pause until they pass a budget and can start paying things. In the past, that has been a problem for Head Start programs, not getting their payments. The Child Care Development Block Grant tends to not be as critical because there's state money going in, and we can put the state money in first and wait for the federal funds to come. But we should not expect the federal government to be riding to the rescue on the Care for Kids wait list. As you know, we've got like 3,300 families on that wait list now. And we're not going to see a big new influx of federal funds like we did during the pandemic to increase that caseload and get rid of that wait list. So that's sort of where things stand now. And we'll know more of where things are going within the next 2 weeks.
Thanks, Meryl. Ayla, any updates from you?
Absolutely. This Wednesday at 6:30 p.m. Well, let me backtrack. This Tuesday at this Tuesday, the Office of Early Childhood would be launching their listening sessions on the endowment. So for anyone at all, parents, providers, family members, anyone who's interested in what is the trajectory and how the endowment is going, the implementation phase of it, they're kicking off their endowment listening sessions in person this Tuesday, September 16th at 6 p.m. until 7:30 p.m. in Hartford. It'll be at the Correct School Central Office, and I could put the address and the info in the chat.
Got it.
The second session is going to be Wednesday, September 17th, 6 o'clock p.m. until 7:30 p.m. But this one will be at the Learn Regional Education Service Center in Old Lyme. I think it's important to mention that in these two in-person sessions, they're not going to have interpretation or childcare. So the Office of Early Childhood makes a promise and a commitment to have a Spanish-speaking session only, hopefully more than one. For those of you on this call who are really interested in being part of that, those conversations in Spanish, know that you are not going to miss information. The conversations are going to be the same. They're presenting the same information in different parts of the state, and they're also going to do it virtually. For this community, the same session virtually is going to happen with us September 29th. So on our Monday call, our normal Monday call that you all come to on Monday, September 29th at 9:30 a.m. Until 11. So it's going to be a slightly longer session. They wanted more time. So 9:30 to 11, we're going to have the Office of Early Childhood on, talking about the endowment, doing a deeper dive into those questions that we all have. And we've been storing up because we're waiting for them to have answers. Switching gears to childcare for CT. I know it's the same night as the OEC listening session, but childcare for CT is done with their summer recess from continuous meetings. We're back up and running and meeting. So this Wednesday at 6:30 p.m. until 7:30 p.m. online through Zoom, not webinar, normal Zoom meeting so we can see each other. We're going to have our community meeting. If you're interested in participating in that community meeting, 6:30 p.m. until 7:30 p.m. this Wednesday, just check out Childcare for CT, forct.org to chime in. That's what I got.
I'm actually going to be more specific than that and say it's any event is at Childcare for CT / get involved. I'll stick that in there, and the specific link for that. Meryl, do you have any links or events coming up that you need to share?
The Alliance will be having our member appreciation picnic on Friday. and we'll be presenting Commissioner Bai with a Children's Champion Award there. So if you are a member, you can, and you haven't RSVP'd, please send Vanessa an email if you'd like to join us. We'd love to have you join the Alliance. So you can do that on our website at Become a Member.
Great. Awesome. Thanks, Meryl. Ava?
Yeah, Meryl, by mentioning Beth Bai, the commissioner, reminded me that on September 29th on this call, our Monday morning call, we're going to, if folks are okay, we'd like to record as part of our usual recording a thank you and gratitude to the commissioner. If those of you who have not really heard the news, the commissioner announced her retirement in a press conference over a week ago. Her last day as that we expect is September 30th, so the day after our call. And it would be wonderful to take an opportunity in this community, fill the room, fill the virtual space with as many people as possible to show our gratitude, little hearts, little messages on screen. We'll also have a virtual thank you card ready for you guys to sign. And we wanted to let you know, to tell your friends, providers, assistants, anyone who can join on that call for that very brief period. Is he in the beginning or the end to capture that gratitude?
We'll do it at the beginning. And also, I think we'll try to have that virtual thank you card ready for everyone next week. So you have a week to fill it out and we can present it to her at the meeting. So great. Thank you. All right. Thanks, everyone. Thank you to Laura for providing interpretation for us today. Sorry, there was a little glitch on that Spanish presentation, but it's all working now. You can go in and see everything. As a reminder, often what we have to do is we get the presentations from people. We have to make it a Google Doc, then we have to translate the Google Doc. And there's so many stages where things move around. So if you do see any of these presentations where like something seems a little skewed or it's like overlapping text or whatever, just know that it's because we have to go through so many changes that what we're focused on is getting you the right information, making sure the information's in there. If the formatting or the graphic isn't as beautiful, we let that go because we really focus on making sure the information is translated and accessible to everyone. And even the English version, having it in a Google Doc that's shareable as opposed to a PowerPoint that we have to attach, and it doesn't work. So just letting you all know to have some patience with that if you ever see that. Okay, thanks everyone. Have a great week. We will see you next week.